On this Wednesday night, the pandemic, the parties, and public trust. The politician who broke the rules.
We all have to do better.
And the difficulties of connecting all the contacts to contain the spread. The road to economic recovery. Why the Feds say now's the time to spend money. Risky reveling during a World Series win. The base for a possible super spreader celebration. And filling a much-needed void.
And then say, wow, this is my skin.
The artist brightening the lives of all amputees.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. The message that we have to reduce our social interactions to limit the spread of COVID-19 is clear, but not everyone is heeding that warning. There have been more than 36,000 new cases across Canada in the past 2 weeks. That's more than we recorded in the first 12 weeks since the novel coronavirus arrived in the country. Contact tracing is proving difficult in some provinces as people mask their behavior. As Mike Drolet explains, it's hard to convince the public to follow the rules when political leaders aren't leading by example.
On Thanksgiving, Ontarians were told to keep their gatherings small. And on Halloween, kids in several regions won't be allowed to trick or treat. Thank you. Sacrifices, Ontario Premier Doug Ford said, that were for the greater good. Yet this week, one of his MPPs, Sam Oosterhoff, was outed for hosting a 40-person dinner in a private room at a restaurant. Nary a mask could be seen, and when told to wear them, he and his group said no.
Very good man.
And when pressed on the issue, Ford said an apology was enough.
We all have to do better. I have to do better. Sam has to do better.
Not surprisingly, Ford is getting an earful on social media. And while this is a single isolated case, most of the responses raise the question of an erosion in public trust.
I think that the majority of people would like to do the right thing, but what is the right thing to do? That message is getting confusing and is, and in some ways not really making a lot of sense.
And epidemiologists say that public confusion is already having a negative impact on measures like mask wearing and distancing.
People, social gathering.
Which in turn damages the efficiency of contact tracing, which relies on memory and honesty.
I think people are, whether it's shame or whether it's fear of penalty, but are not reporting who they've contacted, have not reporting where they may have come in contact with the virus, because some people may not want to admit they were at a social gathering or at a specific event.
There have been so many cases in Toronto, contact tracing is now only being done for outbreaks. And in Alberta, health officials haven't been able to narrow down where 43% of new cases originated. It's a problem, says Craig Jenny, that's ultimately up to all of us to fix.
The one thing we can control in this whole pandemic is our behavior. And it seems like in many instances, we're simply choosing not to.
Mike Drolet, Global News, Toronto.
Here's a look at the numbers across Canada today. There were more than 800 new cases in Ontario. In Quebec, more than 900 new cases and 17 more deaths. There were 287 new cases today in BC. 410 in Alberta, 67 in Saskatchewan, and Manitoba reported nearly 170 new infections. With case numbers rising quickly in that province, the chief nursing officer is warning hospitals are starting to feel the strain.
Our ICU, just checked before we came in, is around 92% occupancy, which was higher than on Monday. And I can also report that we have canceled 43 surgeries.
As of today, there are 89 people in hospital in Manitoba, 19 of them in intensive care. The province's top doctor says many new cases have been linked back to Thanksgiving. He's urging people not to throw Halloween parties. The Federal Public Health Agency is warning of the far-reaching consequences of COVID-19 in Canada. In its annual report, the agency says the pandemic has had a profound impact on Canadians' well-being. People have reported exercising less and drinking more. The opioid crisis is escalating, and mental health issues are on the rise. All Canadians are feeling the impact, but it's been hardest on seniors, essential workers, racialized Canadians, women, and people with disabilities. Dr. Theresa Tam is calling for structural change to address inequalities.
The virus didn't create new inequities in our society, it exposed them. These findings are more than just uncomfortable facts about our country during this pandemic. They are the lived realities of countless Canadians.
In terms of Canada's financial health, we're getting a better sense of how long it might take to recover from COVID-19. The Bank of Canada is keeping its benchmark interest rate at 0.25%, and it plans to keep it there until 2023. For more on the forecast and the factors at play, let's bring in David Akin in Ottawa. David, what is the government banking on to get the economy back on track?
Well, Robin, if you wanted to buy that new car or do some home renovations or maybe borrow a bit more to get yourself through the next few months, go ahead. The Bank of Canada has got your back.
If you're a household considering making a major purchase, if you're a business considering investing, you can be confident that interest rates will be low for a long time.
Once upon a time, Bank of Canada governors worried about ballooning household debt. No longer. This one, Tiff Macklem, wants Canadians to spend. And that's why the bank took the extraordinary step Wednesday of all but guaranteeing that interest rates will remain as low as possible until 2023.
We do think it's important to be as clear as we can about how we see things today. That will help Canadians make the decisions that they need to make.
Consumer spending was the key to the recent reopening recovery, and it will be vital in the months ahead.
We expect consumption to be the leading driver of the recovery.
So, while the Bank of Canada does its part to make it as easy as possible to borrow and spend, it will be up to the federal government to provide income support programs for consumers and businesses. And on Wednesday, the government indicated it will do just that.
We are, first and foremost, a country of survivors. And one of the first lessons of survival is that you must do whatever it takes, whatever you can, when the wolf is at the door.
Deputy Prime Minister and Finance Minister Chrystia Freeland says the details will come later, but it is clear that consumer and business income support programs will not only continue, they may be enhanced.
Doing too little is more dangerous and potentially more costly than doing too much.
But all that spending so far has not been enough or not in time to save many of the country's businesses. Statistics Canada reported today that between March and July, more than 80,000 businesses, that's about 10% of all the businesses in the country, have shut their doors. Robin?
David Akin in Ottawa. Thanks, David. Migrants working in caregiving and domestic roles in this country are facing job insecurity and are vulnerable to exploitation. 200 care workers, many of whom live in their employers' homes, responded to a survey from the Migrants' Rights Network. Nearly half say COVID-19 shutdowns resulted in them working longer hours with fewer days off. 40% of respondents say they didn't get paid for the additional labor. The stress on these workers is being made worse by employers limiting their movement. 1/3 reported not being allowed to leave the home, not even to send money to support family members in their home countries. The Migrants' Rights Network also says care workers who have lost their jobs during the pandemic face roadblocks in finding new work because of the long and arduous process of applying for a new work permit. 16 BC firefighters who tested positive for COVID-19 are under quarantine tonight after returning home from the front lines in California. The BC Wildfire Service says 3 initial cases were reported in the U.S. 13 more were confirmed after crews returned home. It's unclear how the first 3 were infected, but contact tracing is now underway. 223 BC firefighters were sent to California to help with the state's worst wildfire season on record. More than 7.5 million people in California alone have voted early in the U.S. presidential election. They're among the record 75 million Americans who've already cast ballots nationwide. And voters are keen to get the results, but every state has its own rules when it comes to processing and counting mail-in ballots. Jackson Proskow reports on the looming chaos in the final count.
In Pennsylvania, they've already received 2 million mail-in ballots. The monumental task of opening and counting them can't begin until Election Day.
We have to be patient. People have to know the system is different in different states.
The 3 states that decided the last election will be the last to start counting their mail-in ballots. The result may be no result for days. Wisconsin says it won't count all its ballots until November 4th. Michigan and Pennsylvania say it could take until Friday, November 6th to declare a winner.
There are some states where you might see President Trump winning on election night or early on election night, but once these mail-in ballots are counted, even the next day or a day later, that they could switch.
The potential confusion cuts both ways. The in-play states that could decide the presidency quickly do allow for an early count. Arizona, Florida, and North Carolina will deliver the bulk of mail-in and in-person results on election night.
It would be very, very proper and very nice if a winner were declared on November 3rd.
There are fears Trump may seek to exploit delays that are already built into the system, even though states have weeks to certify their results.
You may have President Trump declare victory on the first day if he is ahead in some states, and then he may then say that it's fraudulent as the absentee ballots are counted.
There are also fears of potential court challenges targeting the results. A decisive win by either candidate makes that less likely. The bigger worry may be all the ballots that are still outstanding. States are waiting on millions of them to be returned amidst new warnings about heavy delays with the U.S. postal system. Americans are now being urged to drop off their ballots in person to add a little certainty to this uncertain election. Robin?
Jackson Proskow in Washington. Thanks, Jackson. COVID-19 is a major issue in the final stretch of the campaign, and both candidates have very different approaches to the health crisis. As Mike Armstrong reports from West Virginia, there's a huge difference between how their supporters see it, too.
This state is about as red as they get. The latest poll in West Virginia gives Donald Trump a 2-to-1 advantage. It's not that there aren't many Biden signs here. There aren't even many Trump signs. The campaign doesn't need them.
I feel confident, yeah.
Gail Hartley's doing her part with a Trump flag and jokes that West Virginians sort of get ignored during presidential elections.
I think the last presidential candidate we had was George Bush.
That's a while ago.
That's a while ago. We don't see them.
Now, what this state has in common with others is its struggle with COVID-19. The 7-day average of positive tests has jumped close to 50% over the last 3 weeks. There's a severe upswing. West Virginia has 10 days of early voting. At one point, they had to close a polling station after a polling worker tested positive. Despite that, when the president complains about coverage of COVID-19,
COVID.
His supporters here tend to agree.
The media has blown it out of proportion.
I truly feel like he's trying to keep the country from panicking over it, to be quite honest with you.
Well, I've seen very few people sick, and I've seen a lot of people broke. Economically, it's been devastating.
Now, as Americans cast their ballots, the difference in how supporters of the candidates view the pandemic is striking. When asked about various issues, there's always a gap, but it's usually small. According to a recent poll on foreign policy, 50% of Biden voters say it's very important versus 53% of Trump voters. They're close on abortion, they're even close on Supreme Court appointments. But on the coronavirus outbreak, it's a massive gap. 82% of Biden supporters say it was very important to their vote, but only 24% of Trump supporters.
COVID, well, we have a spike.
That said, in a close election, even turning a small number of Republicans away from Trump can make a difference. There's a reason the president's been desperate to change the conversation.
COVID, he's complaining.
And his critics have pushed it hard.
The more we're talking about it, the worse it becomes for Donald Trump. The fact that he himself was diagnosed with it was not a great look for his campaign.
Now, there is another way the pandemic has hurt Trump. His strongest argument going into this campaign would have been the economy. Well, the bottom's fallen out of that because of COVID-19. Trump still pushes it, but instead of saying, look what we built, he has to say, we'll build it again. Robin?
Mike Armstrong in West Virginia. Thanks, Mike. The Los Angeles Dodgers won the World Series for the first time since 1988, but a player is making even bigger headlines. Justin Turner was removed from play during the 8th inning after receiving a positive COVID test. But the third baseman turned up later for post-game celebrations, hoisting the trophy, embracing a teammate, and posing maskless for team photos. He's also sitting next to manager Dave Roberts, who's a cancer survivor. The Democrats are desperate to win the White House, but winning the Senate is critical too. We'll explain coming up. The U.S. election has 35 Senate seats up for grabs. These are critical to both parties, and as Eric Sorensen reports, Democrats hope to win a hat trick on election night: the White House, the House of Representatives, and the Senate.
In Georgia this week, Joe Biden had more on his mind than the presidency.
Let's give the people of Georgia 2 new senators.
The U.S. Senate is a crucial part of Biden's expanding game plan, not just to win, but to have the power to govern effectively after he wins.
It's a travesty, a travesty.
Democrats could only watch in frustration this week as the Republican-dominated Senate confirmed President Trump's third conservative Supreme Court nominee.
They won't be able to do much about this for a long time to come.
Democrats control the House of Representatives, but to push an agenda forward, Biden needs the Senate.
Given the degree of polarization that we see in the U.S., without support in both houses of Congress, a president really can't legislate.
The Republicans currently hold a 53-47 advantage in the U.S. Senate. To gain control, the Democrats need a net gain of 3 or 4 if Joe Biden loses, because the vice president breaks a tie in the Senate. Every 2 years, roughly a third of the Senate seats are contested. This year, 35 races. Most are Republicans in red. You can take many of those off the map because they are considered safe for re-election. And of the 12 Democratic seats in blue, all but about 2 are also considered safe. So where does that leave us? Well, the Democrats will probably lose in Alabama, but they could win in Arizona, in Colorado, in Maine, in North Carolina, and in a few other competitive races. The bottom line is there are many more opportunities to turn red Republican seats into blue Democratic seats. Republican senators suddenly find themselves being dragged down by the top of the ticket.
I felt kind of bad after the first debate, quite frankly.
Lindsey Graham is down to the wire against Democrat Jamie Harrison in South Carolina, what should be a secure Republican seat. And Arizona Republican Martha McSally even dodged questions about Donald Trump.
Senator, the question was, are you proud of your support for President Trump?
I'm proud to be fighting for Arizona every single day.
Is that a yes or a no for President Trump?
Legislation.
The president deflects suggestions that some senators could lose because they're tied to him.
I probably helped some. I don't think I hurt anybody. But I don't view them as being tied together. I never did.
On election night, a bigger win for Democrats than running up the score for Biden would be squeaking out a second victory, taking over the U.S. Senate. Eric Sorensen, Global News.
Don Masinkowski, a longtime conservative from Alberta who served in Parliament for 25 years, has died.
I now invite honourable members to rise.
In the House of Commons, a moment of silence in his honour. Masinkowski served as a cabinet minister under 2 prime ministers, Joe Clark and Brian Mulroney, and as deputy prime minister from 1986 to 1993. Masinkowski passed away Tuesday night at the age of 85. Back under lockdown ahead, a surge in COVID-19 cases forces France to bring in new restrictions. France has announced a second national lockdown, banning travel between regions. Beginning Friday, people will only be allowed to leave home for essential work, to buy essential goods, or seek medical attention, or exercise for 1 hour. Businesses such as restaurants and bars will close. On Tuesday, France recorded 523 new coronavirus deaths, the country's highest number since late April. Germany reported a record 14,964 new COVID cases. Only around 25% of Germany's intensive care beds are still available. The rise in infections has prompted a new partial lockdown. Beginning November 2nd, restaurants and bars will close except for takeout. Live theater and movie theaters will shut. There will be no crowds at sports events, and those who can work from home are being encouraged to do so. Up next, crafting change, how a Nigerian man's work is increasing inclusivity. Every year, thousands of Canadians lose a limb. The experience is traumatic and has a profound impact on a person's life. An artificial limb is usually a major part of the recovery process. But for someone who isn't white, it can be hard and expensive to find one that matches their skin tone. Crystal Gumansing has the story of a Nigerian man who is trying to make the industry more inclusive.
Hands, breasts, ears, any body part needed, John Sonde is ready to create it. He's an industrial fine artist, but his work took him in a new direction about 3 years ago when his brother lost fingers in an accident. His option for a prosthesis? was a white hand.
His behavior changed. You know, this guy is not happy, and God forbid he could have taken his life, maybe. So I had to do something fast and quick.
The global prosthetics industry is expanding to include more skin tones, but it's a relatively small industry. Product availability is based on demand and the cost of manufacturing on volume. The War Amps says a non-white amputee can end up spending more for a prosthesis.
There aren't any sort of off-the-shelf options, but what the company can do is paint the color or do a customized version, but then that can get very expensive.
Annalise Petlock says health coverage for Canadians depends on what province you live in. War Amps, through its key tag donation program, helps cover some of the costs for children and adults, but many people still end up having to fundraise. A prosthetic leg that starts above the knee, for example, can cost $60,000.
You should be able to get a limb that matches your skin tone, that allows you to replicate some of the function that you've lost. And right now, the way that the funding is across the country, we're being restricted.
Petlock, who is also an amputee, says provincial governments need to increase funding to better support amputees. Sonde has seen how the right prosthesis can change a life.
They hug me, some have to hug me for minutes and then say, wow. This is my skin, this is my skin, this is my skin. And I just feel satisfied, you know.
His brother Michael is also satisfied and much happier with the hand his brother created for him. Crystal Gamansing, Global News, London.
And that is Global National for this Wednesday. I'm Robin Gill. Tonight, your Canada is Ottawa. Thank you for watching, and I'll see you back here tomorrow. Have a great night.